I treated my client yesterday for a side bent tailbone, and that is normal today, but she is sore down in this lower part of the pelvis, lateral to the sacrum. Is that on both sides? Is it more on the right?
More on the right than the left.
Okay, all right. I'm going to do a spring test on the flat part of the ischium right here. And you notice that I can push and I see a little bit of movement, but it's less than normal. And once I take up that movement, I'm not able to get any spring mobility. And that's true on this side also. I'm just trying to imagine what would have made that joint so tight, and I don't have a good answer. But anyway, so behind the pubic joint is the ischium, and that's a rather flat part of the anatomy. That's what I'm springing. So we're going to see if we can treat that. I do feel some increased tone in the sacrospinous ligaments, and I feel that on both sides. It's difficult for me to spring them on both sides. The sacrotuberous ligament, I'm able to do a normal spring. Okay, so let's have you lay on your back. I like to use a fulcrum. It's a very thick joint. It's about 1.5 inches tall, and then front to back is at least 3/4 of an inch thick. Width can vary. She's had 3 children? One child, natural childbirth?
Yes.
Okay, all right. The width of the mid-pubic region is typically about 2 millimeters, but in a postpartum female, even years after, it can be more than that. But anyway, I'm just gonna put this under on both sides. Let me put that underneath there. But it's such a strong joint that if I want to create some movement there, it's not gonna happen with me popping her pubic joint. You know, there's a muscle energy technique, bend your knees, okay? And you pull in for 10 seconds and I resist it, and then let go, do it 3 times, and then we separate the legs, pull them apart, 3 times 10 seconds, you know, and you hear a popping. Does it feel better? Yeah. Well, when I pop my knuckle, it feels better, but it doesn't mean it needs it. And that popping is not your pubic joint getting realigned, okay? It would take a lot more force to get that to move. That's a tendon inside a sheath creating a negative pressure, okay? Put your legs out straight. Yeah, put your legs down, okay? To get that very, very strong joint, you know, and those bones to glide forward, it's gonna take 5 minutes. So we'll stop filming. I'll set a timer.